Every year, millions of Americans and Canadians walk into a hospital and walk back out. Broken bones set, infections stopped cold, hearts restarted, cancers caught in time. We take it for granted, this invisible armor that modern medicine wraps around us. But it wasn't always this way. For most of human history, sickness was a death sentence, and the cure was often worse than the disease. Long before the stethoscope, before the X-ray, before the antibiotic, there was guesswork. For thousands of years, human beings understood almost nothing about what caused disease. Illness was blamed on evil spirits, on imbalances in the body's four humors: blood, phlegm, yellow bile, and black bile, on the wrath of God. Treatments reflected those beliefs. Bloodletting, draining blood from the body, was practiced for over 2,000 years. Physicians believed it restored balance. In reality, it often killed the very patients they were trying to save. Even the first president of the United States wasn't spared. George Washington fell ill with a throat infection in December 1799. His well-meaning doctors drained so much of his blood over 2 days that historians believe the bloodletting itself accelerated his death. He was 67 years old. But it's important not to paint the past entirely in failure. Indigenous peoples across North America, including the First Nations of Canada and Native American tribes, had developed sophisticated systems of plant-based medicine long before European contact. Willow bark, nature's aspirin, echinacea for infection. These weren't superstitions. These were observations passed down over generations. As European settlers arrived in the 1600s and 1700s, they brought their own medical traditions and their own diseases. Smallpox, measles, typhoid. Populations that had no immunity were devastated. The collision of worlds became in part a medical catastrophe. The 19th century cracked the door open, and everything changed. In 1854, a British physician named John Snow was investigating a cholera outbreak in London. Instead of blaming bad air, as most doctors did, he mapped the cases, house by house, street by street, and he traced every single infection back to a single contaminated water pump on Broad Street. He didn't know why the water was making people sick, but he knew that it was, and that was enough. He removed the pump handle. The outbreak stopped. It was Louis Pasteur, a French chemist, not even a physician, who finally answered the why. Through a series of elegant experiments in the 1860s, Pasteur proved what is now called germ theory, that infectious disease is caused by microscopic organisms, bacteria, viruses, living things too small to see. A British surgeon named Joseph Lister heard Pasteur's work and had a radical idea. If germs cause infection, what if surgeons cleaned their instruments? What if they washed their hands? At the time, surgeons wore the same blood-stained coats they'd worn for years, as a badge of experience. Death rates after surgery were catastrophic. Lister began using carbolic acid to sterilize everything in his operating room. Mortality rates plummeted. America and Canada were slower to adopt these ideas. But by the 1880s and 1890s, hospitals on both sides of the border were transforming. No conversation about the history of medicine in North America is complete without stopping in Toronto, Ontario, in the year 1921. For centuries, type 1 diabetes was a death sentence. Children diagnosed with the disease would typically waste away within months or years. There was no treatment, no hope. A young Canadian physician named Frederick Banting had an idea most of his colleagues found far-fetched. He believed the pancreas held the key. Working with his research assistant Charles Best and with the support of biochemist James Cullen, Banting's team isolated a substance from the pancreas of dogs. They called it insulin. In January 1922, a 14-year-old boy named Leonard Thompson lay dying in a Toronto hospital. He was given the first ever injection of purified insulin. Within hours, his blood sugar normalized. Within days, he was walking. He lived for another 13 years. Frederick Banting and John MacLeod were awarded the Nobel Prize the following year. Today, insulin keeps approximately 8 million Americans and 300,000 Canadians alive. It is one of the most important medical discoveries in human history, and it happened in Canada. During World War I, more American and Canadian soldiers died from infection than from combat wounds. A scratch could become sepsis. Sepsis could become death. Surgeons amputated limbs not because they had to, but because it was the only way they knew to stop the spread of infection. Then, in 1928, a Scottish bacteriologist named Alexander Fleming came back from vacation to his messy London laboratory and noticed something odd. One of his petri dishes was contaminated with mold, and everywhere the mold grew, the bacteria around it had died. He called the mold Penicillium notatum. He called the substance it produced penicillin. Fleming's discovery sat largely ignored for over a decade. It took two other scientists, Howard Florey and Ernst Chain, to figure out how to mass produce it. By D-Day, 1944, Allied forces had enough penicillin to treat every soldier wounded in the Normandy invasion. The death rate from bacterial infections fell by a factor of many. For American and Canadian physicians, penicillin was transformative. Pneumonia, once a leading killer, became treatable. Strep throat, scarlet fever, syphilis. One drug, dozens of diseases that had killed for millennia, suddenly survivable. For the first time in history, ordinary people in cities like Chicago and Montreal, in small towns across the prairies and the American South, began to believe science could save them. If antibiotics were the miracle of the 1940s, vaccines were the miracle of the 1950s. Polio terrorized North America. Every summer, it swept through communities, leaving paralysis in its wake. Parents kept children out of swimming pools, out of crowded places, out of movie theaters. They were afraid, and for good reason. In 1952, the United States recorded nearly 58,000 polio cases. It was the worst outbreak in American history. Then, in April 1955, a researcher named Jonas Salk announced that his vaccine worked. The news was received like a peace treaty. Church bells rang across the country. Americans and Canadians wept in the streets. The latter half of the 20th century brought not just medical breakthroughs, but medical access. In 1965, the United States launched Medicare and Medicaid, for the first time, providing health coverage to the elderly and the poor. Canada went even further. In 1966, the Medical Care Act created a universal single-payer system, ensuring that every Canadian citizen, regardless of income, could see a doctor. Two countries, two different paths, but the same underlying belief that medicine shouldn't just be for the wealthy. The 1980s brought a new kind of terror. HIV, a virus that attacked the immune system, began claiming lives at an alarming rate. For years, it was treated as a stigmatized, untouchable crisis. Activists in both the United States and Canada fought governments, pharmaceutical companies, and public indifference to demand funding, research, and compassion. By the mid-1990s, antiretroviral therapy transformed HIV from a death sentence into a manageable chronic condition. Today, medicine moves at a pace that would have been unimaginable to any physician from even 50 years ago. CRISPR gene editing allows scientists to rewrite the code of life itself, potentially eliminating inherited diseases before a child is even born. Artificial intelligence can now read X-rays, detect cancers, and identify rare diseases with accuracy that rivals and sometimes surpasses experienced physicians. And in 2020, the world was reminded, sharply, that medicine still has battles left to fight. COVID-19 killed millions worldwide, but it also produced something remarkable: the fastest vaccine development in human history. The mRNA vaccines, authorized for use in both the United States and Canada, within less than a year of the virus being identified, drew on decades of foundational research that few people had even heard of. Science didn't stumble, it ran. The challenges ahead are real. Healthcare inequity persists in indigenous communities, in underserved urban neighborhoods, in rural areas on both sides of the border, where a hospital can be hours away. The opioid crisis continues to claim lives. Antibiotic resistance threatens to undo a century of progress. But so does the determination of the people working to solve these problems. The history of medicine is not a straight line from ignorance to knowledge. It is messy. It is human. It has been shaped by war and luck and brilliant accidents and stubborn scientists who refuse to give up. By indigenous healers whose wisdom was ignored for centuries. By patients who demanded to be seen. It has been shaped by a farmer's son from Alliston, Ontario, who thought he could cure diabetes. By a bacteriologist who went on vacation and came back to a contaminated petri dish. By a child named Leonard Thompson, who woke up one January morning in 1922 and realized he was going to live. Every time a doctor washes their hands before surgery, every time a child receives a vaccine, every time someone survives something that once would have killed them, they are the beneficiaries of every lesson, every failure, every breakthrough that came before. Medicine didn't save us all at once. It saved us one discovery at a time.